Hello guys, welcome back to Medico Days. So today we will be doing the part 2 video of the toxic medical colleges revised list for the postgraduates who are applying for Neetpg 2025 counselling. But before moving on to the video, I would like to say to you that there is a disclaimer. You cannot use this list alone for choosing your colleges because this is purely based on the reports and the assessment which is given by students or postgraduates in the list which I had in the PDF which I had put in my group. So from that I have compiled this. So guys, if at all there is any college or subject which you like, then please inquire it with the students or the postgraduates who are doing their PG right now in that college, or you can go there and inquire about it. Based on this list alone, please don't make your decisions because this is based on the decisions which are based on the opinions which are given by postgraduates there. But sometimes the teachers can change, the faculties can change, and what is the toxic for one person may not be felt as toxic by another person. So everything, there's a lot of things. So guys, you cannot purely depend on this list alone. So now moving on to the details of this video. So we have discussed anesthesia and biochemistry. Now moving on to community medicine, Kasturba Medical College, Mangalore. There is verbal abuse, shouting, humiliating and abusive language from the head of the department and administration, and it happens several times a week. Next is dermatology in MNR Medical College, Telangana. Physical abuse is there, like slapping, hitting, physical punishments from the faculty members, and there is, the students have mentioned something as others also, but they haven't specified what exactly is the reason. Next, it happens daily. And next one is the S. Nijalingappa Medical College for ENT. Excessive workload without adequate rest is there, and the reason responsible is from the administration side, and it happens several times a week. Again, has also told about S. Nijalingappa, and MNR also few other students have told. Then DY Patil, Kolhapur, ENT is toxic. Verbal abuse is there, like shouting, humiliating and abusive language from faculty members, and it happens daily. Next is the Chhattisgarh Institute of Medical Sciences. ENT and ophthalmology are toxic. Verbal abuse, like shouting, humiliating and abusive language from faculty members and nursing staff or allied health workers is also present, and it happens daily. Next is the RG Medical College, where forensic medicine and medicine are toxic. Verbal abuse, like shouting, humiliating and abusive language is there from the senior residents, senior PGs, faculty members, and it happens several times a week. Next is so as you can see, the remaining part, like academic sessions for biochemistry, yes, the toxic behavior was the toxic behavior targeted at you or at others. It was like always equally both in all most of these situations, in the academic sessions and also in the OTO procedure rooms also. Mostly it was equal, but some students have told that it was at them, targeting them, and many of the times it was moderate, and some of the times many times also it was extreme also. And students, they required help from friends, and in extreme situations they thought of quitting and doing self-harm. So there was a significant impact on their learning in all of these colleges, the students who have studied there, and they were unable to function academically. So did the toxic environment affect your patient care? Yes, most of them said that it has affected their patient care frequently, and also some of them had said yes, occasionally. So did you report the incident to anyone? Yes, many of them have reported to an external authority like MCI or NMC or police, and yes, some of them has said to the faculty or HOD. So the ones who have told it to the external authority, no action was taken. When one student, when they told it to external authority, they faced retaliation for reporting, and when it was told to faculty or HOD, action was taken, but the problem is continuing, and few of them, they haven't reported itself. Some of them have told to the college administration, action was taken, but many a time, and sometimes the problem was resolved in few cases, but in majority of the cases the students haven't said, it's not reported yet. And some of them, when they have said, they have faced retaliation from for reporting it to the faculty or HOD, and most of the cases it is not reported or no action taken. So these was the list about the biochemistry, ENT, and anesthesia and dermatology community medicine. Now, if you did not report, what was the main reason? This was asked to the students who did not report. So many of them said that there was fear of retaliation, believe nothing would change, and fear of retaliation. And this was the main reason. And in your opinion, what changes would help to reduce it? So, and some of them said that communication in a respectful manner will improve. Others said that changing the department staff. Few of them said that reducing the workload will improve the quality of treatment. And some of them said that choose a seat wisely after very careful background inquiry. And next, another person has showed proper coordination of seniors with juniors. Next, another person has showed should permit granted leaves and not cut attendance. Next, need better academic training. Work friendly environment should be there between the seniors and juniors. So reporting the incidents, PG residents standing united. So all that are the ways to improve. So senior PGs, mostly the second years, use the first years. Then sadistic attitude of the seniors should go, and healthy environment should be there amongst the students. And please don't be biased towards PG students. You can't change thinking of your faculty members. Then PG wing to be established. It's required to change the mindset of every hospital. Only seniors, experienced professors should be mad. So different people have given different opinions. So proper stipend to be given, good consultants who are willing to teach, not scammers, reducing the workload, biometric attendance system, centralized exam pattern like DNP trainee should be there, make strict norms. All these were some of the opinions given by students to reduce the toxicity. Next, any additional details about the incidents? So some of them said that the associate and assistant professors were toxic, patient attenders also were toxic to some of them, multiple dropouts were there every year in their college, a few suicides were also there, one assistant professor slapped a person. So all that, they saw I was struggling and they refused to help, they yelled. Then thanks for giving me a chance to share it. Yes, guys, this is an opportunity for you to share your things with others so that others will also let know about the situation and they can choose wisely. So, and openly threats to detain, not allowed to sit in the exam, insults, humiliation, good for nothing, will not sign thesis, will not give leaves, not allowed to present paper or poster, and forms committee to detain and detain for petty reasons, targets unwantedly and disrespects verbally, targeting in professional and personal life, faculties at fault in some colleges, not the HOD, college pays the stipend, they take back 3/4 of it. So all these incidents are happening in a few of the colleges students have mentioned. We are being paid around 50,000, out of which 33,000 is taken back. So for learning surgical skills, even to attend OT, they are facing difficulties. So all these were about the first set of colleges. Now moving on to the next colleges. First, forensic medicine and pediatrics is toxic in RGMC Thane in Maharashtra. So here again, verbal abuse like shouting, humiliating and abusive language from faculty members is there. It happens almost weekly. Next is the Sri Siddhartha Medical College. In medicine department, there is verbal abuse like shouting, humiliating, abusive language from faculty members, head of the department and from the administration, almost happens daily. Next is the GMC Nagpur in Maharashtra for medicine, where verbal abuse, shouting, humiliating, abusive language from senior residents or senior PGs happens daily. Next is the Pondicherry Institute of Medical Science in Pondicherry, where medicine is toxic, verbal abuse again from faculty members, head of the department, and it happens daily. Next is the GMC Halwani in Uttarakhand, where again medicine is toxic, verbal abuse is there from senior residents, senior PGs, faculty members, and that also happens weekly. Now, next is the Bangura Samilani Medical College, where medicine, OB-GYN and respiratory medicine is toxic, which this college is in West Bengal. So here again, verbal abuse is there from senior residents, senior PGs, faculty members, and it happens daily. Next is AIMS Bibinagar, where medicine and ophthalmology are toxic. Verbal abuse is there from faculty members and head of the department, happens weekly. Next is Osmania Medical College in Telangana, where medicine and orthopedics are toxic. Verbal abuse is there from faculty members, happens daily. Next is the Madurai Medical College in Tamil Nadu, where medicine, orthopedics and OB-GYN are toxic. Verbal abuse is there from senior residents, senior PGs and head of the department, and it happens daily. Next is the Vimsar in Odisha, where medicine, pediatrics, OB-GYN is toxic. Mental harassment is there from and there is constant insults and intimidation from senior residents, senior PGs and faculty members, happens monthly. Next is the SSKM, where medicine, pediatrics and surgery are toxic. Verbal abuse, that is shouting, humiliating, and abusive language from senior residents, senior PGs, and faculty members, which happens daily. So next is Oxford Medical College in Karnataka, where medicine pediatric surgery is toxic. Physical abuse is there, like slapping, hitting, and physical punishment from senior residents, senior PGs, faculty members, and it happens daily. So next colleges I'll be discussing in my next video, guys. So till I come back with my new video, stay tuned. So in this video we have covered a few subjects like medicine, pediatric surgery, dermatology, ENT, community medicine. So that's it, guys, and forensic medicine and pediatrics also done. So guys, till I come back with my new video, stay tuned. I'll be coming up soon. So bye bye till then.